I'm your host, Marsha Florence for Just Ask Podcast Live. Thank you, ladies and gentlemen, for tuning in. So as usual, I always get excited when I see you on because why? I did some research and found out some information for you. So, as usual, sometimes you see a guest in the house. Well, today, nope, it's Marsha's Recap Day. And what does that mean? That means that I'm going over information of previous guests that provided for us so that in case you missed it, you have an opportunity to tune in and find out what it is that you miss. So definitely, even if you do miss me in particular, you can always go to Facebook and look at our shows. So if you're on Facebook and you decide to go to Just Ask Talk Show Facebook page, you can see all the shows that we actually record on Facebook. You can always visit us on YouTube, Just Ask Talk Show, our website, justasktalkshow.org. Now, a lot of times people want to send me a message, ask me about a show idea, whatever. There's the number, 1-800-323-5336. And you can always reach us that way. And definitely I return calls, so don't think that I won't. I will return your call, answer your question. The one thing I do know as a retired social worker, I, take pride in knowing what I know so that if someone calls to ask me a question, that means that they are confident enough or feel confident enough to want to know if I know the answer or not. And I always say, if I don't know the answer, I bet you I know who do. Okay, so what that means is that I will find that answer. I will look it up, make some phone calls for you, connect you to the right person, and hopefully that you can utilize that services so that you can, get whatever situation that's in front of you, behind you, or resolved. A lot of times, I had a lady call me not too long ago that needed some assistance, of course, and she was saying that as she was growing up, she was taught that she should never take handouts, that you work hard for what it is that you receive, and that's that. Well, a lot of times in the medical sense, what you pay for when you pay FICA, things like that, when you pay in your taxes, these programs are allotted to you whether you have regular insurance coverage or if you have an extended insurance coverage, if you have Medicare, Medicaid, whatever, and you got Blue Cross Blue Shield and you have HAP and all that. These services are already paid for through your tax-earned dollars, okay? So when you say, well, I was told I should never do that because, I'm taking from someone who has less than me. Sometimes we all fall down. We all fall down. And when you fall down, you're trying to figure out how to get back up. And sometimes you can't. You can't do it by yourself. So don't ever feel like you can't give us a call and ask us a question for resources. Or if you know some information and would like to share it amongst the community, you can give us a call and give us that resource and we'll share that amongst the community. And that's what Just Ask is all about. Just Ask is your education and resource talk show. We don't just do talking heads. We produce healthy cooking shows. We produce fitness first programs for the couch potato and the wheelchair user. So we are a medical profile program that has a variety of resources for you to be entertained with as well as learn from. All right. Now I'm going to skip over something because it's almost that time of the year. October 5th, of this year, 2023, is the third annual Health and Fun Fair, celebrating the human spirit. Now, what does that mean, celebrating the human spirit? We always want to recognize our disabled and elderly population, their caregivers, and the general public. That means we want to make sure that there's a day of fun and frolic for those who are in need. When the pandemic hit, everyone was just locked down, and the only ones could get out and go about was the ones who were pretty much healthy, as we would say. But you come home, you're tired, you're irritated, and that loved one who is a senior or a disabled person can't go far, couldn't have any fun. So we here at the Just Ask Talk Show and the Just Ask Foundation designed a program with our partners, Bridging Communities, to definitely have a day of fun for our disabled and elderly population. So we encourage as many medical resource agencies that can come about. Give us a call and join us on this day at the Eastern Market. I mean, the Eastern Market is full, guys, so there's no way you can't have space. I mean, it's so wide open. We have free food, entertainment, raffles, mobility service trucks that do somebody's service. So Disability Network, Mobility City, wheelchair cleaners, Wayne Mobile Unit. You'd be surprised who's going to be there. So just make sure that you're one of those people, okay? And those who are suffering with mental illness, NAMI, National Association of Mental Illness, will be there. You'll be surprised who comes through. And the main thing is, it's you, okay? Okay. So I left it up there for a little bit. So in case you don't, get a chance to write that date down, October 5th. But you'll see all the beautiful flyers shortly posted out and everything. And an organization that you may be affiliated with, may be attending or have an interest in stopping by. So I encourage all of the resources that's a possibility that provide a service to persons with disabilities and senior citizens. Give us a call. Where we at? 1-800-323-5336, and let us know you'd like to be one of our attendees or vendors at the Just Ask third annual Health and Fun Fair. And don't forget, we take volunteers too. We had so many volunteers last year. Okay, everybody had a pretty T-shirt, ate well, played well, danced in the middle of the aisles. And did I tell you that Dorsey Therapeutic Massage School comes to join us also? I mean, they had like 10 massage students with the massage chairs, and the chairs were lined up. People were sitting in the chairs on the side waiting on their turn to get that massage, honey. And you know what? I miss mine, so I'm gonna make sure I get it this year. Okay, so that's one thing. That's a highlight. It's free. It's free. We appreciate Dorsey Massage School for coming out to join us, and the students are very, very cordial and passionate about what they do. So, we don't have anybody roughhousing anybody and everything, but the attendees just enjoy that in general. To know that someone is, taking out the kinks and bugs on my shoulders for a few minutes, just relax. But I feel as though everybody can't afford it, I know, a massage, but if you can't afford it, I would suggest that you call the schools like Dorsey Massage Therapy School and find out if they have discount rates like $10 or if it's free because the students are in training. You'd be surprised what services out here that you could get for partially free or free. So something like that, if you feel like you need a massage and you just don't think that it's in your budget, you still can call and find out from the schools, if you can utilize that service for little or nothing at all. And that's the same thing as dental coverage. You don't have dental coverage, but you need to get your teeth cleaned, or you want to get a tooth extracted, or just get a hygienic checkup. You can always contact the colleges and find out from the colleges, Wayne State, UAD, Mercy College, my alumni. Okay, you can always contact them and say, hey, I need to know if you have a sliding scale for low income or no income individuals to get their teeth cleaned or to get a dental checkup, things like that. And you'd be surprised. Now, sometimes you feel like, no, I don't want no students practicing on me. Well, once time you're a student, now that you are the teacher, okay? So everybody's not a student. They turn into the teacher. So my suggestion, ladies and gentlemen, is always, if you're on a budget, a fixed income, you always try to find the free resources first. And if you can't find them, then who do you call? Just Ask, okay? And we will try to connect you with the free resources in your area that you can utilize. And that could be transportation. Some places have free transportation. Do you know that if a person has cancer, then they're going to be going to chemo treatment, most of them, and I'm not sure if all of them, but most of the physicians have connected to your chemotherapy treatment transportation. So you're getting weak, or your loved ones are busy or whatever have you, and you got to go to your treatment. You always ask your physician is transportation available? Or who do I call to find out if I can get transportation to and from my treatment appointments? And you'd be surprised, okay? So don't ever think that, well, I'm sick and I can't get around and I'm sick, and there's nobody there. There is us, just ask. So we will try to answer that for you so that you at least know that you can contact a resource to get you to and from the doctor, or if you're looking for, like I said, some free medical attention. I forgot the name of this agency, but I want to, excuse me, I'm going to look them up about free breast exam. So there's another one too about free breast exam. So you can always go to your health departments. We no longer have Herman Kiefer, but we do have health departments. City of Detroit Health Department, Oakland County Health Department, River Ridge Health Department. Go to your health department also and find out what else you can get. If you need a physical, or if you need to be tested to make sure you don't have any venereal diseases or conditions. Don't be afraid to utilize what the system has created for you. That's the problem. We're afraid to utilize our resources that are created for us, because somewhere along the line you look at it like an embarrassment. The other side, you look at somebody gonna see me, but you're the one sick. I wouldn't care. I mean, if I'm sick and I need some services, I'm gonna go see about myself. I'm like, so you here? I'm here. Okay, cool. All right. So you see me walk through the door, the health department. Okay, what? But I need to take care of myself. So this is what I'm saying. I'm trying to encourage all of you who feel as though you don't want to go to a doctor or go to a free clinic or utilize free services because you think it's an embarrassment. No, 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 no. It's not an embarrassment. It is a grant that is granted to you, a service that is granted to you. Okay. Now, with all that being said, I had to get that all out because sometimes people get a little leery about who's doing what. But I wanted to share with you guys in our last couple of interviews with some folks, there were some resources that are starting to end. So I believe it's changes in Medicaid cover a COVID era, expanded eligibility ends, and disenrollment review begins again. All right, so what that means is, excuse me, we originally had coverage for between 15 to 18,000 people who qualify for Medicare insurance under the PHE and FFCRA provision. Well, that program is about to end because when they were otherwise not eligible to include them before COVID, the COVID program or the COVID situation opened up a window for extended services to be available to persons who may not, who at once upon a time were not eligible to use these extended services. So the COVID-19 PHE will end or has ended as of May 11th. Halting federal emergency fundings to states to support the COVID-19 expansion services and support. Now, what that means, ladies and gentlemen, is that now, at some point, you're going to have to contact your state department, your health departments. And what that tells us is that in order for you to re-enroll to make sure you have this coverage, you either are going to contact your local MDHHS office or visit michigan.gov/mybridges, or you're going to call the state health department. So you want to make sure that you're eligible for the extension of this plan, because while actually the plan has ended, and now you want to find out if you can re-enroll in a program or in a plan that will give you additional coverage. Because not only did this program end, but it also, you were getting those free COVID tests. Now you can't get the free COVID tests. So each plan can choose, how to administer this benefit. Enrollees should contact their plan and customers service line for more information, because the access to free government-sponsored OTC COVID-19 rapid test kits are no longer available to these beneficiaries who are not enrolled in a Medicaid Advantage plan. Okay, so if you're not enrolled in a Medicare Advantage plan, you can no longer get that free COVID-19 rapid test kit. But you can always call, and I don't know if you can see the number, but I'm going to give it to you. The health department, it's this 855-789-5610, 855-789-5610. If you're a computer savvy person, you want to go to www.michigan.gov/Michigan Bridges. Okay, and you can type in your questions, and a representative will walk with you through that, or go to your nearest, MDHHS office and talk to your social workers and find out if you can enroll in that program and get the extended services. So, what we don't want to do is have people fall off and they say, oh, well, I didn't know I fell off. I thought I could still go to the dentist, or I thought I still could go to get this additional care. Now, they stopped some of that. And you don't want to have that on your conscience that you didn't get that additional care. Okay, so what I'm saying is, in a nutshell, don't delay getting something that you truly need, which is that coverage. And some of you didn't use it. You didn't know you really had it. You didn't use it. You're like, well, what was it? Well, if you were sick and needed to go to the doctor and you couldn't afford, the copay and all that, that stuff was covered. If you needed those test kits, that was covered. If your family member was on, the ventilator in the hospital, that was covered. So a lot of that stuff came through during the time of the pandemic, and that's what was all covered. All right. So we have to now realize that, even the moratorium on the housing, all that stuff has been ended. Okay. It came at a time when we really needed it because we were introduced to COVID-19. They didn't know what to do. Some of us couldn't go to work. Kids couldn't go to school. Healthcare providers couldn't visit homes. So a lot of programs were put in place due to COVID-19, and now they have ended. Okay. All right. So with that being said, this looks familiar. Excuse me. Well, those of you who, get a chance, you can always tune in to us on Wednesday mornings at 5:30 a.m. But beyond that page right there, or that ad right there about the Just Ask Talk Show, I wanted to share with you about Laura's Hands, pairing seniors with college companions. Now, I like this program, Laura's Hands, because when I was in college, so long ago, I remember that they paired us with seniors and facilities that house seniors. So it's not just students who are studying gerontology, which is the study of the elderly. It's not just for students who are in physical therapy programs and stuff like that. But this companionship program actually helps families. It actually helps families. Okay, so both women here in this picture spend a valuable time together and have developed a strong bond because a student comes in and gets familiar with an older person who may be living alone, and that older person has somebody to talk to. And not only do they talk to, they actually get a chance to learn something. So each person in these positions actually learns something from each other. So this student here, this young lady here, she was an Eastern Michigan University student, and she would meet weekly with the lady in the picture, Janet, to provide companionship and help her with household chores. Now, we're not saying somebody's coming in your house to just clean your house. No. You may just be sitting and having lunch with someone. You may be walking to the park with someone. You may be, helping them put away items that they can't do by themselves anymore. And, this allows a elderly person to feel wanted and to feel, as though they have someone to relate to. So those who don't have children, those who don't have extended family members, nieces and nephews and stuff like that, Laura's Hands may be a good program for you to want to consider trying. And if you're interested in getting involved, they have a phone number, 734-896-5674, 734-896-5674. Or you can always visit the organization on Facebook at facebook.com/Laura's Hands, /. Now, I would suggest you do that. Go to the website. Well, go to Facebook. So it's on Facebook at facebook.com/Laura's Hands, /. And that way, at least, if you are interested in deciding if that works for you to have somebody come to your home, you want to get an idea of it first to feel like you can trust that person, or that person is someone that you don't mind coming to visit your house. Okay, so we do encourage that you do take a look at that and don't just jump into it. You want to make sure that they're matched, so that will work for that. Okay, so usually, I'm an advocate for seniors. No doubt, seniors and persons with disabilities. But I do know you have to be extremely cautious, because we did a show with Dan Tripp not too long ago, Point Professionals and Eagle Financial director. So was he a director? I have to find out. Okay, so he works for Eagle Financial. But anyhow, we talked about scams. Now that's another thing. We want you to be extremely careful. We're not telling you just go out here and get somebody to come to your house and help you put up knickknacks, and you don't know if this is the right person. I'm going to say, I don't care who you are across the board, put a camera system inside your house. And if you have a close relative that, they may not live here in the city or whatever, but they can connect to your camera and watch you move around in your house, or watch who comes in and out your house, that's a plus. That is a plus. We've gotten so modern now that why not, if you're not going to be the person that's going to be able to sit there day in and day out with your elderly loved ones, that have a camera system, and they can talk to you through the camera, or they can watch activities. Definitely at the door, especially when people are coming through the door. You want to have a camera system somewhere where it aligns with who's coming to the door. Okay, who's sitting in the living room? What's going on in the kitchen? The only room may be off limit is the bathroom and maybe the bedroom. But to have a camera system put in, blink, what's the other ones? What do I have? I don't know. But, any of those camera systems that you think that will work, that will help you still be able to watch over your loved ones, I would encourage it. Okay, so whoever invented those things, hats off to you. I have one too. I'm trying to think, who do I have in my house? Do I have Blink? Okay, bro, I think I got Blink. Okay, so Blink, Ringtone, Wiz, all these different services. You should use them inside as well as outside, especially if you are watching over a family member. And you could show them how this camera is going to allow them to talk to you, and you can see them, and they'll feel a little bit more comfortable too. They would definitely feel more comfortable. Okay, so I would highly suggest that if all possible. Now, here I went to this page in caregiving, and let me say this: I'm going to also acknowledge that our past guest, Pat Rencher of Urban Aging News, she supplies most of this information. So I gotta find out what did I do with Pat's flyer. Okay, so we looking at information that was supplied to her. So Caregivers Coaching is a free program for the Area Agency on Aging 1B that aims to smooth the way for caregivers by matching them with professional trained volunteer coaches. That's the same thing, no, not the same thing, but close to what Laura's hands were. So these coaches help caregivers identify needs and address obstacles. The program is available to family caregivers who reside in the AAA 1B service region, or who care for a family member who resides in the region. So that's the Detroit area. There is no cost or specific time committed to participating, and the caregivers may contact coaches by phone or Zoom for resources, challenges, or just to talk to. Okay, so in other words, a coach is available because people who have limited family members and friends, this is one of the programs that you can utilize. So to become a coach or be matched with one, you can call 1-800-852-7795, 1-800-852-7795, or visit, that's what they call it, AAA1B.org, Caregivers Resource, Caregivers Coaching, okay? So that's AAA1B.org/caregiver-resources/caregiver coaching. That's a lot. But so call the number. I would say call the number. That way you'll feel better knowing that you call the number. So this is another program just in case you are looking for, if you're a caregiver and you want to receive a coach to work along with you or something or other like that, why not? All right. So we have different things for different reasons. So, okay, now I'm running out of time. But before I run out of time, I always got something to tell you. So With that being said, who is this on this lucky page that I like? I always like somebody, okay? And when I like somebody or something, I like to share that, okay? Let's see, we got the programs for elder fraud. Now, a lot of stuff is on here: fitness, lifelong learning, program services. But elder fraud was the one that caught my attention, okay? So the National Elder Fraud Hotline. Now, ladies and gentlemen, you know somebody that got scammed. Don't be afraid to call the number and find out what you need to do to see if you can help that loved one get their money back or secure themselves from future fraud and scam situations. So those who want to report a scam or who have questions about potential scamming, you're going to definitely reach out. AARP Fraud Watch Network Helpline. 877-908-3360, 877-908-3360. And don't wait till something happens. Just go ahead and call them. Call them and find out what are some of the scams, recent scams that are, taking place and how to avoid it. But down below it says scam map. Now, I don't know if you can see that scam map. For a list of current scams in your zip code, go to www.aarp.org. So you want to know what scams have taken place in your zip code. Go to www.aarp.org and definitely call the number 877-908-3360. Now, I was intrigued with that because, scams is on the rise. They ain't just here in the state of Michigan. They all over, and people are just getting carried away. And you see it on the news so often, somebody's being taken advantage of. So why not help somebody out? Don't let the person, go under, and they didn't have to. Especially if the seniors have all their life savings sucked up because somebody was being mean.
If you love them enough to suck the snot out of their nose at 4 a.m., then surely you'll check NHTSA.gov/the right seat to make sure they're in the right car seat.
Well, my time is up. I had some more stuff for you, but I'm running out of time, so I'll catch you on the next round. But what do I always say? If you know a person with a disability, or if you just have a general question, you know me, and I don't want you to be afraid to ask. I definitely want you to make sure that you remember. You can watch us on Wednesdays at 5:30 a.m. or catch us on any of the networks: Comcast Detroit, Comcast Southfield, Wide Upper West Troy, YouTube, Facebook, and much, much more. All right? And don't forget to come to the fair. Looking forward to seeing you. I'm your host, Marsha Florence, for Just Ask. And what do I always say? If you know a person with a disability, or if you just have a general question, don't be afraid to ask. Just ask. I'm your host. See you next time.